Hi everyone, I am Tara, aka Spirit Mother, and I would like to welcome you all back to my channel on YouTube, Spirit to Spirit Teachings of Going Within Self, on TikTok, 1974 Like Soul, and I'm also on my Facebook. If you're new to my channel, I always recommend, suggest, and really encourage you to read the description of my YouTube channel, Spirit to Spirit Teachings of Going Within Self, to get a better understanding of what it is that I bring forward on my channel. Some of you are, me, I'll make you laugh before I push you off. I spirit. And I use a lot of my own life experiences to bring awareness. Okay. And I talk about the medical, dental, and what have you. Now, I was in the other week because on November 25th, I went to the dentist. And then I went to the dentist again today. Okay. First thing, he did an x-ray and, he just stuck the first dentist on the 25th, stuck his finger up and kind of pressed there. Okay? That's what it. My tooth ain't loose or nothing like that. And today when I went in, she just she didn't even really touch. It was like, it's been some weird experiences with the dental. It's like somebody's really trying really fucking hard to have me have this tooth pulled, get a root canal. Because, I got a documentary here with regards to the complications with a root canal. Okay? And I've been doing a lot of research because I read body language. I read people's energy and intentions and what have you. And, like I started speaking in the language and I could hear the doctor's thoughts, like, this girl has mental health issues. And so I heard like, yeah, you think I have mental health issues. It's like I connect with spirit, and if you guys ain't got that yet, then I didn't learn these languages anyway. And people want to attack me, and that's just fine because what the hell you get through every fucking day because you don't want to live and look at your own shit. Because the first thing they want to do is a dead tooth. Like a root canal is done with a dead tooth. I've been looking at. I have the stuff here. Okay. Now my tooth isn't dead. I feel it. She told me I don't have infection, but I have all the signs of infection except for the swelling in the gums. But other than that, I have all of it. And she said that, pulling the tooth or doing the root canal will get rid of it, which I actually looked into it. And before doing all that, you're actually supposed to get rid of the infection. But she told me, oh, you don't have any infection. I did a video the other day that, all the other drugs for a tooth infection is like 14,000 milligrams, and they give me 1,500 milligrams because I have an allergy to penicillin. Where's the fucking sense in that? There was one drug, that drug that they gave me was 5 pills, 1,500 milligrams, but even penicillin and amoxicillin, you were taking like 14,000 milligrams. And I told her, like, the effect, well, I don't see any infection. Okay? You did an x-ray. You didn't look at my mouth. You just went like that. Okay? Now, I've done some looking into alternatives to root canal because there's a documentary on YouTube with regards to root canals. A root canal or extraction is supposed to be the last resort because a root canal actually kills the tooth. And a root canal is usually performed when the tooth itself is dead. And my tooth is not dead. It's still, it's got a cavity, but it's still living. It's not turning black or anything like that. I have an infection. So now this here is the documentary is called Root Cause Root Canals. Full documentary that's on YouTube. Right now, I went in and I was looking at the alternatives. Okay, first off, here, this is the symptoms. of an infected tooth. Tooth, infe- tooth infection symptoms include severe throbbing pain, which I have that, like I try to push down and it hurts. Facial gum swelling, which, I don't have that, but I got like a little pocket up here. So it comes every so often. Fever, sensitivity to hot, cold, bad taste, and swollen neck glands, which I have that. And she told me, well, if I pull the tooth, that'll get rid of it. But yet it says that before pulling the tooth or doing a root canal, you're to get rid of the infection. So often from untreated decay, these signs signal an urgent need to prevent it serious. Okay. So I asked alternatives to root canals. They tell you the alternatives. They just tell you, oh, a root canal or pull the tooth. But let's not get rid of the infection first. She told me I had no infection, but yet I have all the signs. And the last dentist I went to, he said I had an infection. Oh, I don't see any signs of infection. You didn't look in my mouth. You looked at an x-ray. So it says alternatives to root canals and extractions focus on saving the natural tooth. Pulp gapping. I have that up here. I'll read it. Pulpotomy, ozone therapy, PRF therapy, if the damage is limited or involves extraction followed by replacement, implants, bridges, what have you. But she told me that I couldn't get an implant, I couldn't get a partial back here. I've seen many people that had partials back there. See, the thing is, it was really strange because it was almost like word for word. Okay. And people say, oh, well, that, it's a dentist. The dentist knows how to give you a root canal or pull your tooth, but they don't give you the alternatives. Severe cause, right? The choice, depending on the infection extent, cost, and potential preference for natural versus restoration methods. Así que por ejemplo, okay, we'll get into it. Okay, so let's see. Pulp capping, direct or indirect. A protective material is placed over the pulp, living tissue. My tissue is living. I feel hot and cold, and I feel all the sensations. So it's not dead. Protective material, living tissue to encourage healing. Used when the pulp is only slightly exposed or close to exposure. To promote, to encourage healing. So natural healing. But instead of doing, that part first, they automatically go to extraction or a root canal. She even canceled my appointment for the 30th to go in for a filling because I'm not filling. But you didn't do anything to my tooth. The same as the first dentist. See, you don't like me. Maybe you're a dentist. Maybe you should be referring your patients to alternative therapies or alternative things before doing a root canal or extracting the tooth. Go watch the documentary, Root Cause. I watched it, and the horrifying stories, like I even had like stuff up. So let's go to the next one. The next therapy, pulpotherapy. Pulpotomy. And it's not a debate. This is not a debate. This is what I'm bringing up. So the AI thing that comes up and says, oh, a debate about dental. It's not a debate. It's the facts they put on the internet. But see, they don't want you going and looking. And that's the thing. You know, you should be encouraging your patients because when I asked, well, how much is it for a root canal? And, you know, getting trying to, it was almost like pulling teeth. Didn't want to give any answers. So that causes alarm for me. Spirit was just like, yeah, no. So I will trust spirit before I'll trust someone who's trying to make a profit, even if they do have a credential. But you don't do what you should be doing, and that's giving the choice of the alternatives. So if you don't know the alternatives, maybe you should educate yourself. You know, you are a dentist. So the pulpotomy, Pulpotomy, removes infected pulp from the crown, top part of the tooth, leaving healthy pulp in the roots, often for younger teeth or specific causes. Okay. Next one, ozone therapy uses ozone gas to kill bacteria and disinfect the area, promoting healing, often combined with other methods. Why don't they tell you this? See, I know that it's infected and the infection is going. So, you know, I figure, you know, it's like, I guess if I end up with sepsis, well, maybe you should have got rid of the infection first and gave me alternative therapies before saying, you know, oh, well, we got to extract the tooth. But yet in other research, it says that, you know, you should get rid of the infection prior to extracting the tooth. I had this tooth removed back in 99. And I did this the other day, back in 99. And it was infected. And they didn't get rid of the infection before pulling the tooth. So the infection created an abscess and it kept abscessing. I kept trying to break it and it would abscess because they didn't get rid of the infection first. It doesn't take a dentist, it doesn't take a rocket scientist to know that, you know, even if you go in for surgery, they ask you about infection before they'll even give you surgery. Well, a root canal and an extraction is a form of surgery, is it not? It's an open fucking wound. Ugh, please stick out. Platelet rich fibrin therapy uses your own blood's healing factors to regenerate tissue and reduce inflammation, supporting natural healing. She told me that I couldn't get a partial in here, but in research I could. You know, like the other day I asked, where'd you get your license from? Because I thought the Cracker Jack box stopped giving them out a long time ago. See, and my ex-husband gets irritated with me. For 10 fucking years, he went to a dentist because he had pain. His mouth was so infected, his whole fucking body was infected. And all they kept telling him, oh, come in every 3 months and get your teeth cleaned. He actually had decay and rot. Like, I mean, severely. And it was just a couple of years ago, even this dentist place, like for about 2, 3 years, they kept telling him, "We'll come in every 3 months and we'll clean your teeth." He had to say, like, basically remove my teeth, and then he had to pay more than $55,000 to get a fucking set of teeth in his mouth. So no, I don't trust ones that will not give you alternatives. When the alternatives are there, you just don't give the patient the alternative. And then it says if access is necessary, which to me, all those other alternatives should be the first measures taken before going to the extent of doing surgery. That's how infections get going, because if you get a root canal, one of the main side effects is continuous infection. I told her, like, the pain goes all in here. The infection is in my body. Just because my gums aren't swollen. She did nothing. She, like I said, she looked at an x-ray and she went like this on my face. She didn't look in my mouth or nothing. But is that not supposed to be part of an investigation? You can't just look at an x-ray. So what? Because we're not educated, we're stupid? No, we're only stupid because you don't give us all the facts. See, the thing is, it's not supposed the patient, you're the doctor, or you're supposed to be. You're supposed to be giving your patients the alternatives. But you don't. You give them two alternatives: a root canal or pull the tooth, which those should be actually the last resort. Every other therapy should be addressed first. But they don't do that. Other surgical options for failed root canal, you know, root and surgery. See, people can try to silence people like myself or make us shut up, but you can actually go fuck yourself. How can you call yourself a doctor? Do you get a kick out of causing more pain for people? Why are you not putting these therapies out there prior to trying the alternatives, prior to a root canal or an extraction. It's a legitimate question. And I'll tell you right now, all you people should be asking the same thing before going in and getting a root canal or an extraction, which is actually before going in and getting surgery. So, pulp capping is a dental procedure to protect the tooth pulp when it is exposed or nearly exposed during a cavity preparation. It involves placing a protective material such as calcium oxide or MTA to prevent further inflammation or death of the pulp, allowing it to heal and form a protective dentine barrier. There are no two main types. There are two main types: direct pulp capping for when the pulp is directly exposed, and indirect pulp capping for when a thin layer of dentine is left over the pulp. See, they don't tell you this. She never told me all this. She was like trying to have a conversation. Was like pulling teeth. So Spirit was like, you're reluctant to like really answer any questions. Direct pulp capping, when it's used, when there is a tiny accidental exposure of the pulp during a deep filling or restoration. A deep filling, she told me I couldn't get filling, but I could actually get a deep filling. When I said about this tooth over here, this tooth was fucking broke right in half. So it was a major cavity, and I could still take and stick like something in through it. But they didn't remove it. They didn't do a root canal. They filled it. But she said, "Oh well, that was different. The tooth was fucking broke right in half, but the nerve was still living." So I'll ask you again: where did you get your practicing license? Because I thought they stopped giving those out in the Cracker Jack boxes. People have mental health issues because of people like that. That's when I said the other day, doctors do not listen to their patients. Patients said that, oh, well, you got no say. When the patient is the one that's actually supposed to have the say, ask questions, and ask for alternatives, why don't they want to do the alternatives? Because a root canal actually causes more problems in other parts of the body, but they don't tell you that. Go look in the documentary, root cause. And my ex-husband should know better because he was the one who brought the fucking documentary to me. Procedure: a protective dressing is placed directly over the exposed pulp to protect it from bacteria and other harmful agents. So when I eat, the food gets in my tooth. So I use a toothpick to remove it. So when you get food in there, it creates the bacteria. what? Because I don't have a credential. I have common sense. So I have a lot of awareness, and I read your energy, and I I hear your thoughts. And she thought I had mental health. That's what you want people to perceive. People like myself, people with mental health issues. With all due respect, you're the ones liking to cut people out without doing alternatives. Your first go-to is, hey, let's cut somebody open. Seriously, the technology is out there to regrow, and I'm bringing it forward now. It's like you don't want this. Maybe like the parts of the nature, you don't want this getting out because truth be told, the goal to promote pulp healing and encourage the formation of reparative dentine bridge, repairing the tooth. But they don't tell you this. They just say, oh, well, we got to pull the tooth or we got to do a root canal, which, if you're on any form of assistance or a disability or anything like that, they don't cover root canals. So your only alternative is to have the tooth fucking yanked. Maybe you should actually be doing your job and giving people the alternatives so that they can make an informed decision. Besito por aquí, no da eso, tú, ay, ay. Indirect pulp capping. When it's used, when a cavity is so deep that it's close to exposure, the pulp, exposing the pulp, but a thin layer of softened tape can be intentionally left behind. So now, like I said, the only thing she did was this and look at it and like briefly look at an x-ray. I didn't even see her look at the x-ray. She just come in and sat down and said, hey, Dara, like, what's going on today? She did not open my mouth and, use to find out the softness of the tissue or anything like that. She just touched. Anytime I had like when I had this dental exam, before I got the filling, they took and they started poking stuff in to see, but she did nothing. I paid 30. The insurance company was paying 64. So that's like $94. So they got $94 for sticking thing in my mouth, taking the picture, and sitting down and telling me, touching my face and saying, oh, you need a root canal or you tooth pulled. Jesus. Maybe I should have been a dentist. I know, like I have bad breath because I have gingivitis. But it says here, like you can get like a restoration during a deep healing. But she said she couldn't pull the tooth and she had cancer for improvement. but the appointment wasn't with her. So how can you cancel an appointment for someone else when it's not your appointment? What, did you get your panties in a bunch because I second guessed your methods? To my ass, like, dude, you had cavities because of all you had bad teeth. The majority because of all the alcohol you ingested. His teeth were literally like they were dead. His teeth were actually dead. And I wish I had this still had the pictures. See, I know a good doctor when I experience one. Doctors take their patients for being morons, idiots, stupid, not knowing anything. I appreciate your patience. I'm looking for because I took pictures and I'm not sure. I think I'm talking about my ex-husband's teeth because they were fucking gross. It's not to shame him or anything. And I mean, they were bad. So these alternatives. Okay, so now, um, okay, procedure. A protective dressing is placed over the thin layer of seed that remains. This is often part of a two-stage process over several months. The goal: to avoid exposing the pulp and prevent pulpitis, allowing the pulp to continue producing repetitive the tin over time. But they take a living tooth that feels the nerves and all the sensations and they kill it. How does that fucking make sense? Oh, wait a minute. It actually doesn't, because you're not trying to save the tooth. When these are things you should be doing. She didn't even like I said. Oh, there's no infection. What? Because you didn't see something on a thing, on an X-ray, and because you touched. Oh, oh, let me do this to you. Oh, and please pay on the way out. To sit in a dental chair. To take a picture, which really doesn't cost them anything. To feel my face. No, I got no respect with people like that. And I also believe that, they all they all stick together because I told them that I had gone to a dentist prior. And they were like, "Oh, well, you're allergic to penicillin." Yeah, I'm allergic to penicillin. But every other drug, penicillin included, and amoxicillin, the two very potent antibiotics that they usually give you first off, was a pill that needed to be taken, two pills, 3 to 4 times a day, depending on whether it was amoxicillin or penicillin. $14,000 milligrams. And I figured it up over 7 days, which most antibiotics are 7 days. 14,000 milligrams. And they gave me 15 milligrams over a 5-day period. Please tell me how that fucking makes sense, whether you're allergic to penicillin or not, because out of the 5 or 6 drugs that they give you for an infection, that was the only one that gave me 1,500 milligrams in 5 days. The rest of them were like 14,000 milligrams. Said, oh, well, doing the root canal or pulling out the tooth will get rid of the infection. No, it doesn't. Because it even says that, even after the tooth pulled, you should give antibiotics. Do you know how badly looks can actually be deceiving? You know, you perceive what you perceive uneducated people, they don't know anything and they're very gullible. They'll believe anything you tell them. Is it that or, they've been fucked over so many times that they just go with the flow? Problem child? You would perceive it that way. But people are only problem children if they question your methods. Yeah. Yeah. See? Questa comunità è allowing the pulp to continue producing dentine over time. So allowing it to start functioning appropriately again without the surgical procedures. This is a spirit to spirit. I'm not sticking my middle finger up at you. And those spirits know exactly who I'm fucking talking to because they like to jump. And people, oh, well, you're just insane. No, I'm actually awake. But they'll tell you I have mental health issues. With all due respect, you're the one cutting people out instead of doing the alternatives. Those are drastic measures. Not saying surgery's not needed, but hey, check out the alternatives first, and that's the first thing they should be doing. Not saying, oh, well, this is it, because it's usually not just it. There's actual alternatives to it. But it's not thousands to hundreds of thousands of dollars. Because, they say they're getting rid of one thing, but it's actually creating another problem elsewhere within the body. It's a good, like I said, call me crazy, good, but I'd rather let the sepsis sit in. And it's not to prove a point. It's to say, hey, you should be listening to your patients. You're stupid as you think they are. Of your own body, and you don't. You just know what you learned in school. Just say, oh, I took hours out of school, nice for you. But we experience the symptoms, but you don't give us all the facts, with which actually makes you lacking in ethics, and you shouldn't be practicing. So if no dentist will touch me because I'm second guessing your methods, and you just want to give me a root canal, which causes more complications, or you want to pull my tooth and say, oh, well, you can't get another tooth back there unless you pay $5,000 to get an implant. And that's just for the tooth. They probably charge like, much more, because my ex-husband got implant dentures and it cost him more than $55,000. And I know somebody else who went and got each individual tooth implanted, and it cost them over 100,000. Why it's performed, save the tooth for more invasive treatments like a root canal or extraction to promote the natural healing process of the tooth. Good. Feels fucking good. Risikutukurikina. You know what I even thought of doing? Because I looked up, like, what do they use? They use a resin plastic. Even thought of, finding the resin plastic and just, taking the utensils and just shoving it in there myself and taking my fucking classes. Years ago, it was a cobbler who did the dental work. Materials used: calcium oxide. Well, what are your teeth made of? Calcium, right? Calcium. Oh, you say it, and calcium. This is the bone. And it does, it goes in, but the tooth is more a calcium. Anybody ever had calcium down here? It's fucking hard, right? Sometimes it'll even poke through. A traditional material that has been used for many years and can help stimulate the formation of new dentin. Why don't they use that? It's been around for years. That should be common use in a dental facility. I like, North America may look like a rich country, but it's pretty fucking poor in education. And I mean, with regards to knowledge about this, layman, I'll say, you may think they don't have intelligence. People like yourself to try to make them feel stupid so you can feel superior. MTA, which is material trioxide aggregate, a newer material that has shown high success rates and is often used for both direct and indirect taping. Why don't they give you these alternatives? Because it teaches you how your teeth grow themselves, regenerate themselves by non-invasive therapies or non-invasive procedures. Because that's what a root canal and a tooth extraction is. It's a basic. Biodentine, a modern biomaterial that is also used for kelp capping. You should either start giving people the alternatives, or you should step in your position and let someone in who will. Pulpotomy, Pulpotomy is a dental procedure often called a baby root canal. It saves a deeply decayed or infected baby tooth by removing inflamed pulp from the tooth's crown part, by leaving the healthy pulp in the roots intact, then capping it with medicated material to maintain vitality and allow the permanent tooth to develop. Okay. It's common in children when tooth decay reaches the inner pulp chamber, preventing infection spread and tooth loss, with the tooth eventually restored, often with a crown. But they use evasive therapies on their children, which your children's teeth should be like their baby teeth should be in their mouth as long as possible, so that it gives the backup, the adult teeth, the strength. But you'll say no, because I don't have a credential that says that I can say this. Do your own investigation. Seriously, you might learn something. And then go in and question your doctor on what you just read and see how they react. Because this stuff should be common knowledge given to the patients. They should have a say in their therapies, in the choices, but you don't give them one. You give them two choices, two evasive choices. You're not doing your job. Don't like me? Good. I really don't give two fucking shits, because I'm not real fond of you either. This is a spirit to spirit. And like I said, those spirits know exactly who I'm talking to, because they're usually the ones that, you know, are the false healers. Because a true healer wouldn't have a problem with giving you alternatives before resorting to evasive treatments. And a root canal and a tooth extraction is a surgery. Tooth to develop. Okay. What it treats: deep cavities or cracks that expose the tooth's pulp, inflammation, pulp plates in the pulp caused by decay or trauma. Seizure, anesthetist. Local anesthetic is given to numb the tooth and surrounding area. Access: a small opening is made in the tooth to access the pulp chamber. You did nothing. And you took $64 from the insurance company and 30 from me. Pulp removal. The infected and inflamed pulp from the crown top is removed, leaving the root pulp. Both the dentists, within a 2-week period, were going to resort to evasive measures. Not one of them told me about any of these alternatives, because I tried the alternative before I had the root canal or the tooth extraction. Medication, medicated material like calcium oxide or MTA is placed on the remaining pulp to keep it healthy and promote healing. Restoration. The tooth is filled and usually covered with a stainless steel or zirconia crown for protection. But mine was choice of a root canal that my medical insurance, dental insurance doesn't cover, or having the tooth pulled. So either way, risking more infection. Because when you go into a dentist, they may not see, but it's usually caused from an infection. So you should be addressing the infection first and foremost, so that it keeps from every other tooth becoming infected, and you saying, oh, well, we got to do a root canal or we got to pull it. Give the people the alternative so that they can make an informed decision. You do say, we're giving you you can make the informed decision, but you don't give them the alternatives to your invasive measures. In some cases, I have to ask, when you go to evasive measures that quickly, do you like causing people pain? Is it a form of torture for you? I'm not saying dentists don't do their job, because there's some that do. But what I'm going to say is, like, North America may look like it's got something, but I would say it's much more like a third world country, because you ain't up together with the technology and up together with the alternatives. Most of you go directly to surgery. There was a young fellow said he wanted to be a surgeon. But oddly, he said the reason why he wanted to be a surgeon is because he wanted to cut people. Don't you think there's something wrong with that? And he was about 14 to 16 at the time of saying that, because he wanted to cut people open to see their insides. He suffered something himself. But his words were to cut people. That to me is disturbing and very alarming. And if it's not to you, you really need to sit with yourself. Key differences from other treatment versus pulpotomy. Pulpotomy only removes the crown pulp. It removes all pulp from the crown and the roots, the whole root canal. Versus extraction. A pulpery saves the baby tooth, prevents space for the adult tooth. Okay, this is with the tooth. My question is, how are children's teeth growing in bad in the first place? They come out of the womb and they're drinking milk. But somehow they have bad teeth. Say hereditary or bone disease or what have you. But what actually causes it? They develop in the womb. So whatever goes in is ingested into the mother or inserted. It's what brings forward whatever. You build your immune system up there, in there, through the mother, but I'm not a doctor. What the fuck is the umbilical cord and the placenta? The umbilical cord is what everything goes through, and the placenta is where the food is stored, the nourishment for the baby. It's like a fucking liver when it comes out. Well, okay, why it's important. Prevents severe pain and infection. Allows the baby tooth to stay in place until the permanent tooth is ready to expert. So it's the big tooth that's actually pushing the baby tooth out. If it falls out naturally, well, maybe that's the tooth pushing it out. People should be looking into this. You're not going to look into it for yourself as an adult. Fucking look into it for your children. Avoids complications like abscesses or crowding. Let's go to the next one. Ozone therapy. Ozone therapy uses ozone, a highly reactive form of oxygen, as an alternative treatment administered as gas, ozone of water, or oil, claiming benefits like boosting immunity, fighting infections, bacteria, viruses, fungi, improving circulation, and reducing inflammation for conditions from skin disease to arthritis, often through metathesiums like enhancing oxygen use and modulating the immune system. However, the FDA warns against it. FDA will pass so many things that is toxic to the human body, but they frown on that. They put a laughing gas in it. They know it sometimes. It's a gas, but would that have to be approved through FDA? People take them. They'll put that over people's faces and then fucking date rape them. Some would probably even take the organs. They do it in surgery. When you go in for surgery, they put that sleeping gas, as they call it. When I was giving birth to my oldest youngster, I had laughing gas. I had no Demerol, I had no epidural, I had laughing gas. And I was breathing it, and yeah, I moved it from my mouth because I was falling asleep. And, my mouth, and all of a sudden I was laying there, and then all of a sudden it was like, flew right over at my mom. They didn't get the pan to me in time. But, during pregnancy, they give you that to breathe in as much as you need, right? But oxygen, calling ozone a toxic gas with no proven medical use. highlighting the risk of severe neurological damage and noting a lack of standardized protocols and risk evidence requiring more rigorous trials. Do they use ozone during surgery? Yes, ozone is used in some surgical treatments, especially in dentistry and orthopedics, primarily for its strong antimetabolic, kills germs, antiviral, and healing properties. Kaya tutuisin mo, Jose. Sulat na po ni Kiriam. Ay, sabi ko ba? Burit na tayo. Gusto ko riyan. My ex-husband's getting another new set of top dentures because they just come out with a new technology so that he could get better dentures. But that woman told that dentist, both the dentists told me that, if I get that tooth pulled, well, you can't get a partial or anything to replace it. But yet they have new technology. How about you do this so that the person's tooth can fucking grow back naturally, heal naturally? So FDA, go fuck yourself because you're contradicting yourself. You've already approved it for the dentist, but you're saying that more studies have. Shit, it kills germs. The dentists use it. Orthopedics use it because of its antiviral and healing properties, often applied as oziate, water, or gas to disinfect surgical sites, reducing infection risk, decrease inflammation, and promote tissue regeneration through more rigorous studies are needed for widespread adoption in general surgery. Used. What is it today? Telling you that you're stupid or anything like that because I know you're fucking smarter than that. Just they have you in that loop. A real dentist, a true dentist who knows its practice wouldn't be afraid to give people alternatives. It's like I'm gonna say people in the spiritual community, clergies, in any field, what happens? You don't want to give information because then if you give any information, you teach others. I know you no longer profit. So you'd rather have people keep coming back so you can profit instead of teaching them how themselves. No fucking wonder I hear him say he wants to press the red button. And it was just 111, 11, 11. Now it was just 511, 5-1. So, some people don't follow each numbers. Some do, open to all of it. Because it all goes hand in hand. Just, you're stronger in certain areas, but, a true master learns it all. And that's what makes for a good teacher. So perfect human. Common applications in surgery: disinfectant, kills bacteria, viruses, and fungi, surgical site, preventing infection. So this is ozone. This is what one of the ozone therapy without the invasive procedures of removing a tube or doing a root canal. Infects it. Wound healing promotes oxygenation, stimulates the immune response, and spreads and speeds up healing after procedures like dental extraction or implants. So couldn't it heal it before the extraction? Because, this is an alternative to extraction or root canal. I can feel that right in here. And my question is, why my ex-husband, he'll say he didn't, but why my ex-husband gets irritated because I don't get a root canal or get a tooth pulled? You got a bit going or something? Just saying. Because both times I went to the dentist and wouldn't have it done, he got fucking irritated with me. So this is why my channel is a spirit to spirit, and it's teachings of going within self. Yeah, I did it, and I'm still doing it, and that's why I'm catching it. There's your cat and mouse, bitch. Because I had a nurse say when I was like catatonic, I could feel everything, I could hear everything, but my body wouldn't respond. She said, "We have sweet food, cat nurse." You must have been a cat predator after the mouse, and the mouse is fucking trying to come to me. Orthopedics, used in interventional procedures for conditions like knee and orthopedics and lumbar disc herniations to reduce pain and inflammation. Oral surgery, applied as ingredient during dental implant replacements or for treating periodontal issues to improve outcomes. See, I may not have the diploma, I may not have the label, but I do know how to read and I do know how to make sense of things. Spirit's my teacher, Spirit's my guide, and Spirit's who I follow. But wait, I don't follow. I work with and walk beside. But when I told her that, that's when I heard her thoughts. Oh, she has mental health. We have mental health only because of people like you who are lacking in integrity. Infection management, explored for treating resistant post-preoperative infections such as spinal injury infections. Okay, so, how it's used. Ozonate water used as a rinse or ignorant during surgery. Ozone gas applied directly to tissue or infected in specific considerations. Benefits and considerations. Benefits. Pretend germ killer, boost local oxygen supply, reduces inflammation, and aids tissue repair. Silotupiesimutor. Simutor C. While promising, especially in dentistry, more large-scale clinical trials are needed in standardizing protocols and fully established its role in mainstream surgical procedures. So the way of finding that out is limiting the use of it by giving the person the ability to make the informed decision. Because it sounds like, it works, but they want to downplay it. Because if you knew that your teeth could regenerate and you could heal yourself, you wouldn't need their invasive procedures. Gusti. People really need to start like waking up and questioning them and their true motives because they're not giving you the truth. Maybe, believe this is the Mayo Clinic. Tooth abscess. Because that's what it is. And I even told her that the infection is going all, like it's going up into here and down into my lymph nodes and the pain go like all through and goes up into here. And she said moving, like removing the tooth would stop that. How is that getting rid of the infection through the rest of my body? Like seriously, I will ask you again. Where did you get your license to practice? Because I thought the Cracker Jack boxes stopped giving them out. Tooth abscess is a pocket of pus that's caused by bacterial infection. I just read the stuff that could help prevent that or help heal it up. Caused by bacterial infection. The abscess can occur at different areas near the tooth for different reasons. A periodontal or preapical, pre-apical abscess occurs at the tip of the root. A periodontal abscess occurs in the gums at the side of a tooth root. The information here is about periodontal abscess or periapical. Periapical tooth abscess usually occurs as a result of an untreated dental cavity, an injury, or prior dental work. It had a filling, and the filling come out. The resulting infection with irritation and swelling, inflammation, can cause an abscess at the tip of the root. Well, the first dentist, he said that the infection was into the root. So if it was into the root, then it meant that the infection was other places. So just pulling the tooth or doing a root canal is not getting rid of the infection that has traveled throughout the body. But she said she wasn't giving me any antibiotics. You know, I would have to ask, is that not like a medical malpractice? Because you're not giving necessary treatment because your ego got in the way? Seriously, you're a fucking asshole. And I say it how I see it. Fuck, you make me sick. You all deserve to lose your license. You do know that, right? You'd rather leave people pain and suffering than do what's right because your ego and your pocketbook gets in the fucking way. You know, if we spit in your face, we can charge, but you're actually spitting in ours. It's like, oh, you're stupid. You throw the rocks. You're not fucking stupid. Dentists will treat a tooth abscess by by draining it, getting rid of the infection. Not one of them in my mode in draining. They said, "Oh, there's no swelling," but yet I told them that I would stick my finger and I would apply pressure, and it would just be fluid, just leaching out. But it's not infected, right? I'm the stupid one. I know nothing, right? With all the respect, I beg to differ. By draining it and getting rid of the infection, they may be able to save your tooth with root canal treatment, but in some cases, the tooth may need to be pulled, leaving the tooth abscess untreated can lead to serious, even life-threatening complications. But she told me by pulling the tooth or doing the root canal would get rid of the infection, which, lady, you're wrong. Go back to school and educate yourself. And same as the man. At least the last guy, he had sense. Like he said, it's down in the nerve. So he gave me like 5 days of medication, which was 1,500 milligrams, compared to the 14,000 milligrams that every other one of the fucking drugs were said to take for it. I think you gave me a drug for a mild case because the other one that was a substitute for penicillin and amoxicillin, it was the same dosage as what penicillin and amoxicillin would be. So, with all due respect, I'm not the stupid one. But you think you're educated. Only for your pocketbook and your ego, because don't question the doctor. He might get their nose in a joint or get butt hurt. No, I have no respect. I have respect for doctors who actually, you know, help the patient and listen to the patient and give the patient alternatives so that they can make an informed decision. Periapidical tooth abscess. Bacteria can enter the innermost part of the tooth, though through enough a deep cavity or a chip or crack in your tooth. The resulting infection and inflammation can cause an abscess at the tip of the root, and that's where he said mine was. It was at the root. My ex-husband was in there, but he wouldn't take my side of his life if the life depended, because I've observed him with it. But hey, I was always the one that stood up for him. But then even when I did stand up for him, he turned on me then. I wonder why I don't want to accept your jewelry or your words. See, the thing is, this was done to me back in 2019 and forward, when I kept, even after my car accident, I kept going to the doctor and telling him something was wrong. This was the same thing. So no, you say you love me, but I know what love is. And I know what love feels like. So your material things mean fuck all to me. So if I don't appreciate them, ask yourself why. That's what tell me I don't appreciate them. I just don't think I don't appreciate as materialistic things because that's not what matters. You're just told you have to. And if I were going to have things, I'd want to buy them on my own. Because at least when you're buying stuff on your own, they have nothing to hold over. Symptoms. Signs and symptoms of acute abscess include severe constant throbbing toothache that can spread to your jaw, neck, or ear. What did I just say? It's in the ear and it goes down here into the lymph nodes, all through my jaw. And I even told her sometimes I feel it up. But there's nothing there. What you know, because you looked at an x-ray. An x-ray shows the surface. It doesn't show the root cause. No pun intended. Or pun intended. I don't know what you look at it. Pain or discomfort with hot and cold temperatures. Shit. Pain or discomfort with the pressure of chewing or biting. To the point where I'm chewing on this side asshole, but you want to pull my tooth. Or you want to give me a root canal instead of, doing what you should be doing. But see, like I said, at night when I'm sleeping or I'm sitting, I'll take a cloth, a towel, because there's so much fucking fluid that comes out that whatever it is that I'm holding over, it's almost like dipping in a fucking towel. Fever. Shit. Fever to the touch. No, it's the cold, clammy sweats. And I thought it was my sheets, but it's not my sheets. It's not my bed stuff. Swelling in your face, cheek, or neck that may lead to difficulty breathing or swallowing. What happens in my mouth, it's like it's inflamed. Tender, swollen lymph nodes under your jaw or in your neck, right here. And they're swollen, all of them. And I go like that sometimes just to try and squeeze them to, I guess see if I can push the infection out. but that's it, trying to protect me. But I don't have an infection. I don't have an abscess. I just need a root canal or to have it pulled and the infection will go away. You're a fucking asshole woman. Did I call names? Let's see. People like calling me a moron. Well, stupid person having low intelligence or an intellectual disability. You're so clouded by the teachings that you don't listen to the patients and you don't educate yourself further. You just keep going on that mainstream teaching because there's less work to do. That should be a mandatory education. Foul odor in your mouth. My ex-husband has been telling me that, your breath is bad. I brush my teeth every day, sometimes twice a day. It's like a thought, that was coming from my guts. I, tried to get it resolved in my guts and, they wouldn't do anything then. But, it's called the infection. You're smelling infection, which you get that. That's what you're smelling. You don't treat people for it. You say, oh, you got to go to this other person. There's more money. And all it may just take is you listening to your patient and putting your ego aside. Infection sends off a foul odor, correct? But you don't treat the infection in a month. And that's where most infections start because it's a sleep and you're constantly swallowing saliva. But some people will laugh because, this is inequitable. Sudden rash or foul smelling or foul tasting, salty fluid in your mouth, and pain relief if the abscess ruptures. Let's see. I get some of that, but last time I get the taste of what tastes like metal leaching. The mold is what, carries the most bacteria, right? It doesn't take education. It's just a little bit of common sense. when to see a doctor. See your dentist promptly if you have any signs or symptoms of a tooth abscess. I did twice. Twice within a 2-week period. Let's see. So today's December 8th. So December 1st was 1 week. And then November 27th was 2 weeks. And I went to my appointment. Oh, 24th. Sorry, the 24th. Okay, so I went December 8th to the 1st. That's 1 week. From the 1st to the 24th. Okay. So today's the 8th. So to the 1st of December was 1 week. And from the 1st of December to the 24th of November was 2 weeks. And my appointment was on the 25th. So it was one day less, 2 weeks. Or, and don't know, don't care. It's not fair. Within the 2 weeks span. This is much like what happened when I went unconscious in 2019 and I was going to the hospital trying to find out what was wrong with me. And they kept telling me mental health, nothing. People wouldn't believe me, but I died at home, and people don't believe me on that. But hey, it's a bright light in the distance. As it gets closer, it turns into 3 lights, then 6, then 9, and then it's just like one massive fucking light. But I know what happened there because it wasn't your physical medical system. It was what you call aliens who actually helped me. With grays, but they were elongated. They were both 5 feet. And then there were other ones. It was like there were 4 of those, and then there were other ones. It was like 8, 6 to 8, and their faces was like it had a fucking light globe on it. After the grays, I felt my spine getting better, and then energetically after the lights, I started experiencing energetic healing. So no, your physical medical system done nothing but treat me like I was fucking crazy. And you'll say that I am now because of what, but hey, I'll tell you, go fuck yourself. It's like the part where, yeah, I feel like I should have a punching bag. I have a punching bag, but I have nowhere to put it up. That's why I come on here. It's bringing awareness because I'm not the only one that experiences this. Only many people don't come forward and bring the awareness so that others can wake up and understand. So no, I got not talking directly to the people. I'm talking to the ones in the system. And they know who they are. So it's going through the jaw. It's going down into here. It's going up into here. It goes up into here. And my stomach gets upset. It's just like, oh shit. So I'm constantly working on healing myself. So please explain to me how 5 pills, 1,500 milligrams in 5 days is going to do shit for you. Such isn't giving me a prescription. That to me is negligent. Let's punish her because she's questioning us. Just sit there. Causes a periapical tooth abscess occurs when bacteria invaded the dental pulp. The pulp is the innermost part of the tooth that contains blood vessels, nerves, and connective tissues. So, like seriously, how many of you know like about an X-ray? An X-ray just shows like bacteria enters enters through either a dental cavity or a chip or crack in the tooth and spreads all the way down to the root. Actually, that tooth right there, the back of it is chipped because I had one of those partials, but there wasn't anything to it, and it it was like a really hard plastic, and it didn't really fit. It was like fucking put together shitty, but it was an expensive price, and it chipped my tooth. It would dig in hair, creating more dental issues and more open wounds and infections. So I didn't wear it a lot. So the tip of the root, and I'll say it again, that dentist on the 25th said that the infection was in the root. So if the infection was in the root, why would you give me an antibiotic for a mild level of infection? It wasn't mild at all. I even told him that I was feeling the pain all in through here and everything like that. And I even told both of them that even felt like I had an ear infection because I go like that and I shove my finger all the way to try to separate it and apply pressure. Risk factors. These factors may increase the risk of tooth abscess, poor dental habits, or care. I brush my teeth all the time. I brush them sometimes, like I said, twice a day. Dry mouth. I don't have dry mouth. Shit, if I went like this, ah ha ha, the infection would start cooling. Complications. The tooth abscess won't go away without treatment. If the abscess ruptures, the pain may improve a lot, making you feel like the problem has gone away, but you still need to get dental treatment. The abscess doesn't drain, the infection may spread. If the abscess doesn't drain, the infection may spread to your jaw and other areas of your head and neck. What did I just say? And I said that I go in there and I push on the tissue around the tooth and I push on the point of the tooth and the drool just it starts pouring out. And I said it's like feeling in my head and everything like that. Hmm. It's more it's more profitable to have an infected nose than it is to actually get to the root problem. Because maybe like, you know, you may start with a slight cavity, but you know, that becomes, you know, an open wound. It's very apt to get an open wound. The abscess doesn't, if the abscess doesn't drain, the infection will spread to your jaw, to other areas of your head, and if the tooth is located near the maxillary sinus, two large spaces under your eyes and behind the cheeks, you can also develop an opening between the tooth abscess and the sinus. This can cause an infection in the sinus cavity. You might even develop sepsis, a life-threatening infection that spreads throughout your body. So twice I tried to get an antibiotic, an appropriate antibiotic. Because people say, well, you're against medication. I never said I was against it. I said I didn't take it, but I know when I need to. If you have a weakened immune system and you leave a tooth abscess untreated, the risk of a spreading infection increases even more. It says drink water that contains fluoride. Fluoride actually causes more damage to your teeth. And you're not like, you know, you're actually not supposed to ingest large quantities of fluoride. Brush your teeth for 2 minutes at least twice a day with fluoride toothpaste. I brush my teeth twice a day without fluoride toothpaste. I even use some toothpaste that has activated charcoal. Replace your toothbrush every 3 to 4 months or whenever the bristles are frayed. I have three toothbrushes in my bathroom. Eat healthy food, limiting sugar items, and between meals snacking. Like ice cream once in a while. I'll have like a chocolate. Very sad last night. I had a couple of candy canes. I don't eat really. I don't eat sweets. I eat fruits, vegetables, fish, and meat. Visit your dentist regularly for checkups and professional cleanings. No, I haven't been to the dentist in a while. As far as cleaning, well, no, I brush my teeth. They say, what is it, 4 to 6 months? Who was it that said about coconut cream? Something like that. Putting coconut in. Consider using an antiseptic or fluoride milk rinse to avoid an extra layer of protection against tooth decay. I did, like, I went into with regards to fluoride the other day. So okay, so that was a tooth abscess. So I asked about root canal with regards to the tooth. Everything you need to know about a dead tooth. This is medical news today. A dead tooth refers to a tooth when there is no longer any blood flow to it. Well, I got blood flow through. I got blood flowing through it into it. The nerves and that are all working well. Sometimes this is also known as a non-viable tooth. Both tooth decay and an injury can cause a dead tooth. My tooth is not dead. What is a dead tooth? A dead tooth has three layers: enamel, beaten, and pulp, which, I just got into, like, just said, with regards to the dead and the pulp, the alternative to a root canal or a tooth extract. The pulp contains the blood vessels and the nerves. So that's what's infected. So it's going in my bloodstream, but they're sending me home, much like they did, like I said, when I died in 2019. A dead nerve in a tooth is sometimes referred to as a neuroticic pulp or a pulpous tooth. Oh, I got a pulp all right. I still got the pulp there because when I bite down, that's when I feel the fucking pulp in there. My body's trying to fight the infection. It's like, the whole fucking medical system should be sued. And I mean like a class action. Because they're the ones protecting these doctors. Dead or dying nerves in the pulp can lead to a dead tooth. A dead tooth will also no longer have any blood flow to it. My tooth is not dead. There's plenty of blood flowing through it. It's fucking pulsating at times. So it's blood flowing through, and it's the nerve endings firing off. It's all trying to protect itself. It's trying to protect me. Once this happens, the tooth will eventually fall out by itself. However, it can be dangerous to wait for this to occur, as the tooth can become infected and affect the jaw and other teeth. I already told them that. But they refused. Well, I mean, not one. They gave me a mild. But she said she wasn't giving me an antibiotic. She canceled me for a film. But it wasn't even for, I believe it was with a different doctor. Symptoms. It is not always easy to identify a dead tooth just by looking at it. She looked at an X-ray. Like I said, something that just more or less shows what's visible, not the invisible. Only a dental professional will be able to diagnose it, which is why regular trips to the dentist are important. There are, however, two main symptoms of dead tooth that can help with self-diagnosis: pain, changing color. It's not that it's pain, it's an ache and it's a pressure. And there's no change in color, but it's because of the blood flow that there's the pressure. I go like that and I can feel it. It's like it's pushing into the pus bucket. And it's not just inside the tooth, it's probably like right up in it. Pain, a dead tooth, a tooth that is dead or dying can lead to a very level of pain. For most non-extant to extremely painful. The dying nerve of an infection usually carries an increase in pain. Some people wonder why they experience pain in the nerve. The nerve is dead. However, the pain is not coming from inside the tooth, but from extremely sensitive nerve endings around the outside of the tooth called the periodontal membrane. Well, this is it's kind of it's like those two, like the cyst or the abscess and the dead tooth. It's like they're contradicting one another. When maybe when you perceive to be a dead tooth, maybe it's not a dead tooth. Maybe you're just not going with it. Not saying teeth don't die, but hey, the reason why teeth die is because they go on treatment. But I went in for treatment and really got none, except for we have to do a root canal or extract your teeth. But you can't put a partial there. Yeah. Bacteria and dead nerve remnants or pus builds up in the pulp cavity inside the tooth and puts pressure on the periodontal membrane, which can cause immersed pain. But we just talked about the pulp in the alternative methods to take before a root canal or an extraction. If there is an infection, it may turn into an abscess and produce other symptoms, including bad taste, bad smell, swelling, a pimple on the gums. I get those. But also right up here, right around there, it's like a lump. It's like an ingrown pimple. Changing color. If the tooth is dead, you often get darker in color, and you may notice a yellow, gray, or black discoloration. The only color there would be a piece of silver from a filling that I had that, part of it come out. The leaching of the silver filling itself probably had a hand in it too. Infection. We'll say it's okay to put that in. Change in color usually occurs because the red blood cells are dying. This is a very similar effect to bruising. The discoloration will usually happen if dead tooth goes untreated and will increase over time. Causes. There are two main causes of dead tooth. Tooth decay and tooth trauma. Decay begins the outermost layer of the tooth, but over time it can cause cavities that pertain into the deeper layers. Well, we went through that. There's alternative methods to help the tooth rejuvenate itself. And that's not a conspiracy theory. That's a truth to life. Only you're not ready. You're, you know, if cavities are untreated, not untreated, they can eventually reach the pulp and create a path for bacteria to enter the tooth and cause the nerve to die. Well, my nerves are dying, aren't dead. So why don't you fucking catch it? Because maybe that's what a lot of people like. Their body is feeling unwell. You're having all these pains. Maybe that's what it is. Maybe you have an infection that has gone untreated because they don't listen to you. You know, look at an infection. It's all tales of what most people experience when they're feeling like really unwell. Treatment. Early treatment is to fix a dead tooth is vital. Even a person is not feeling pain first. They suspect the dead tooth, they should seek medical treatment. Well, my tooth is not dead. An x ray will often help a dentist diagnose a dead tooth. And then extractions and root canals. Go watch Root Cause regarding the root canal because it's horrifying. Ask yourself, have you been having any other problems in your results after you, especially in your back and that? You know, a dentist kills a nerve in your tooth. There are two ways a dentist can kill a nerve in your tooth: root canal or with a tooth extraction. In most cases, it will be best to undergo a root canal procedure. Well, give us the alternatives. And I can almost hazard a guess that people knew about root canals and they knew about the alternatives, then their decisions would be a whole lot different. And it'd be a whole lot cheaper for the person and the system. But that's too much common sense. The system. or it already knows it's common sense. And it just means, it's ego stroke and it's topical stuff. Consequence and drawback. A tooth extraction should always be your last resort. The typical process of killing a nerve in the tooth is referred to as root canal. During this appointment, root canal dentist or the endodontists will make an opening at the top of the tooth to access the nerve. So they'll open it up, which is a surgery, and the alternatives are non-invasive. So either way, the first thing they'll do is go to surgical procedures. If you really wanted to do right by your patients and help your patients, if you're not informed and educated with the alternatives, I suggest you go. Use clove oil, saltwater rinse, hydrogen peroxide rinse. That's how to save a dying tooth naturally. Although it is uncommon leaving a dead tooth untreated can lead to life-threatening complications. Here are the potential dangers. A dead tooth can cause an infection formed near the tooth. This infection can lead to a pocket before pus forming. The abscess can spread. So, I said about the alternatives to basically these should be the first, like these alternatives that I set up, they should be the first go-to before performing any other surgery or procedure. Even with regards to a filling, because it says it will restore or rejuvenate, promote healing. So, I'll just keep sticking my finger in my mouth, going around here and kind of massaging it, and then applying pressure so that it will do that. At least I know I'm getting some relief. How to save a dying tooth naturally.
Maintain good oral hygiene. One should practice brushing and flossing every day in order to avoid destruction and root tissue bacteria exposure. You know how, like, people floss, and sometimes the floss feels like it cuts into the gums. But they say, well, you only go so far. Okay, but what I'm saying is, you get cuts in your mouth, you get sores in your mouth, you get ulcers in your mouth. And that's all caused from the infection. Proper nutrition is vital. Calcium and vitamin D, replenishing foods are good for the teeth and bones. Vitamin D, the biggest source of vitamin D is the sun, but they tell you to mask it when you're putting these chemicals on your body, which that's what's actually causing your body to burn and other things. But you won't believe that either. Yet. Use clove oil. This natural remedy has anti-inflammatory properties that can temporarily alternate pain. I have the clove here, but this is it's like the infection is through me, and just pulling the tooth or killing the tooth is not going to solve that fucking problem. It may even acerbate it because it's not cleared out. Saltwater rinse, boiling with warm salt water, reduces inflammation. Well, my body is like, feels like I had salt water, so I guess maybe my mouth is trying to produce its own salt water. That's why it feels the way it does. It's trying to put its own antiseptic in it to fight it. Hydrogen peroxide. Okay, we went through the truth of dying. Now, I'm going to question that here. Some people wonder if there are any dangers of pulling an abscessed tooth because it could spread infection. Should it be treated first? Our consensus is no. That's what they say. But other stuff says yes. This is a dental place. You get rid of the problem sores and be pain free faster when the tooth is pulled. Okay, so you say the tooth pulled, well, it means it's pus. But what about the infection that's already in your body? That's the part you're not sure. I had a tooth pulled. I'll do it again. I had a tooth pulled over here. And because it was infected and they pulled it, it created an abscess on my gum and I kept like trying to get rid of it. Just like, however, if the swelling is such that it makes it hard to open the mouth wide enough for removal, you would take antibiotics first to bring the swelling down. See, the thing is, it's not all about the swelling. Because your nerves are connected, right? But it's already in your bloodstream. But I know nothing because I didn't go to school to learn this. First, they go to take painkillers, but yet, the alternative helps with the immune system, the inflammation, which inflammation is pain. But the first thing they do, go to the painkillers. And painkillers are one of the most sought after and addictive substances and promotes the most criminal activity because of the addiction. You know, I don't have a doctor's degree. I have personal experience, common sense, and the ability to read people energetically, physically, mentally, and emotionally, and spiritually. If the doctor gets butthurt because you question him, that's one thing you're supposed to be able to do. That's what makes a doctor-patient relationship. The understanding. So a patient could go into a doctor and then something goes on and they can go like, well, what the fuck just happened there? I don't understand. when that happens, it's because the doctor's not doing their job. Much in a rush to get to the next patient because each patient is worth money. The more patients you can get through, the more money you get. So it doesn't matter if you perceive your healthcare being paid by your government or if you, like from your insurance company. It's like it's all in here, down here, up in my ears, up in here, a lot in this year. So I do, like with all this, I do question my ex-husband. I can't understand why he be irritated and not being told what. Because, sometimes I like, say something, dude, you got something to say at the time. I'm just sitting with it, trying to understand and wrap my fucking head around it. Précisément. Just on his forehead. Wasn't cat, but it was a big cyst. It went in and cut it out. It's convenient for them to leave pieces in. So tell your story. Tell the horrifying experiences that you've had. And tell the good ones so that people know where to find the good ones and to avoid the horrifying ones. Everyone experiences everything differently. But in circumstances like these, it's very similar. So it's like feel like saying, so please excuse me if I don't respect them. But on the other hand, it's I don't care if you excuse me. So, like last time, it looks like I'm not going to get medical treatment. But they'll say, well, you're given a choice to have a recap or the tooth extracted. How about you give me the alternatives first and the antibiotics to get rid of the infection? Oh, yes. And drain it and clean it first, like you should have done in the first place. Esse que é poliziano. Estoy, eh? See, people, you look at the reviews. Oh, oh, they got 36 reviews, and they're at a 4.5 star. How many patients do they have? And how many people went to them? Nobody should have to pay $100,000 to get a set of teeth that's actually worth having. Everybody should have the alternative first, and the surgical procedure should be the last alternative. And my question is your ego that fucking big that you get offended by a patient asking you questions? See that? They're having fun with this new electric sleep, so it's easier for them. I had one said that because you have no fucking idea who I am. You have no idea why I'm put in this position because I'm help you fucking heal. I'm here to push them.
to heal. So I guess we're both being assholes to each other because we both got a lot of healing to do together and separate. I don't watch a documentary. I don't really watch documentaries to keep me distracted from my own. Because usually the documentaries you're watching, you can probably relate to them. So go watch. Dr. David Migloff, the root cause, root canal full documentary on YouTube. I don't know how to um, attach these websites. Not much I know how to do. As far as like doing all the fancy doodads and that. Like a lot of fancy, but you know. Pero sí como eso. Lo que poníamos ahí. But I will tell you that most of the stuff that people are probably experiencing with regards to feeling ill and things like that, it's you probably have an infection and it's ongoing because it goes untreated. It's like here one night, Raphael, Gabriel, it was like I could hear them. It was like they were telling me how to connect and move it to get to release it all. I could feel like it was like they teach me how to kind of twist and turn and then grip it and then just apply and then go like that. And not even touching my teeth, I can actually use the energy and the energetics to kind of flush it. So I think the honesty, not deceit. Dice muito, oiga, y con esta éxito, like, right now, there are so many things that happen to people that shouldn't happen because it can't be avoided.
you say the patient is supposed to be part of their healing, their recoveries and things. If they're not allowed to be. Because if they question you, you blackball, you target them, and you do it through your writings. It's like, label someone question you. And I would also question this. Why would you do that? Has anybody ever been to a company and actually did the same kind of did an experiment to find out they had that specialty and they did it to find out how they got treated? You know, what is it? It's like the where the boss disguises himself and goes into their workspace, kind of does his own investigating. What she would do so that I believe in spirit. And by when I say believe in people, I mean as far as the human beings. And spirit's not out for people. You know, to think this can be good because I was happy with the work that the other dentist did. Good, but good, not so good. Yet ones that actually want to help people, the money's good. You have the ones that give a shit about the patient just wants the money.
I'd love to take your money and shove it up your ass. Died before spirits. So I think I could keep believing that and knowing that the spirit will show me how to get rid of it. Because like I said, I'll take my time right now. Take my time. So at least then maybe I might get some help. And like I said, her refusing to give me antibiotics, that to me is a medical negligence. Because it's refusing to. And it is because you're not giving me alternatives. And you're not doing what you need to do. So Raphael, Gabriel, all you that are there for me, whether you're physically here, thank you. And thank all those out there that's like helping too, because you're teaching me very, very valuable lessons. Know who you can trust, who you can rely on, and who you can't. Who's out for money and ego, and who's out for healing and truth. Honey, we're going to beauty. But I'm learning how to make choices wisely. So, gabay, purisita resimo hasari. Halakitu purishala hesikara. Totore. Yeah, totore. See them. Enough snow. Wasted. A little bit of a hill. Just gotta make sure when you're going down that you don't go straight into the freaking pond. Might crash into a few alders or something along the way before you end up in the pond. But hey, a little bruised and hurt.
You failed many times, although you made it. You fell down the first time you tried to you almost drowned the first time you tried to swim. Your questions didn't you? Did you hit the ball the first time you swung a bat? Heavy hitters, the ones who hit the most home runs, also strike out a lot. Babe Ruth struck out 100 or 11 or 1,330 times, but he almost hit 714 home runs. Our age, Macy failed 7 times before his tour in New York, while English novelist John Casey got 753 rejection slips before he published 564 books. Worry about failure. Worry about the changes you miss when you don't. You see it? We're so yeah. A man may die, nations may rise, fall, but ideas, an idea lives on. Enough shovels of earth, a mountain, enough piles of water. Enough for faith gets you to the top. Enough piles of water, a river, to the top as the river flows. The earth brings you to the mountain top. The pails of water of the river is the water and energy that flows you. Thank you for looking at. Few things are harder to put up with than annoyances of a good example. Basically, few things are hard to put up with than annoyance of an example. Ahora sí que podría estar. If you want to make a song more happy, add a few chili beats, whatever that is. That was just kind of like an interruption. Interruption. Is that the? Ooh, yeah, okay. You grow up the day you have the first real laugh at yourself. Well, I guess I'm growing up every day because I laugh at myself every time I do a live video because I see how ridiculous I look. Let's do it. Quando você molha, tá isso, vai. Aracita. Don't like the funny. Aracita, I'm so weird. Yeah. Are you having a little temper tantrum now? It's like, yes. Yeah, the temper's come through now. Let me see a little cigarette. So, hey, I'm going to leave it at that. I'm going to leave it at that. And I'm sending all much love, like many blessings, most importantly, very good health to everyone and everyone who wants to willing to see themselves. I want you all to be good, 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 good. Most importantly, be yourself, be your authentic self, be true and kind to yourself, be true and kind to others. And like I said, it can be hard sometimes. I know from experience, but you got this, and you have the strength because it takes strength for you to be able to experience and feel it. It's a weakness to suppress it. People didn't like that, but it's true. They tell you that, a big person just goes with like, but in the meantime, you're suppressing everything and you're left hurting inside and not healing and getting, maybe you're not getting out there, but it's festering in here. It's like that abscess that I'm talking about. It's like an infection. And that's when people become shoeless and you say you have no soul. It's not about gaslighting, it's about understanding the feelings of others, but we stop caring about that. And then we wonder why, others have no time for us. There were times that, yeah. I did stop caring about, like, you guys stepped over, you got this going on, well, hey, you left me for dead, so why should I give a fucking shit about you? But I'd still be there for the person when it mattered most. And I know a lot of people can relate to this, but the ones that can't fathom it, they'll say, "Oh, you're talking about yourself." We're using ourselves as the example. We're the ones that do the conspiracy theories, the lunatics, the mental health people who actually have spiritual growth that is being suppressed by your mental health theory because you're not making the connection. So question things. Because your doctor shouldn't be pressuring you. They should be guiding you to where you can find out some things to make the informed decision for yourself. Sending all up.